तेरे नाम से एकार साजे दो जहां आगाज तेरे नाम से एकार साजे दो जहां रहमत तेरी सबसे बड़ी तू सबसे बड़ा है I welcome you to this seminar. Assalamu alaikum warahmatullahi wabarakatuh. Good afternoon. Namaste and Sasrikal to all of you. वो कहते हैं ना इस देश को हुआ क्या कहीं रात तो कहीं भी सिमिलरली उसी चीज को लेकर हमारे पास आज का हमारा टॉपिक है दैट्स chronic obstructive pulmonary disorder COPD. First of all, before going to the main topic, let's dive deep into the basics roots of the cause and the system which is affected in COPD. For this, I would like to call here Mr. Abu Bakr. Specific pathophysiology will be dealt with group-wise, that's Abhishek and Basit, but region-wise physiology will be discussed by me. इसके result क्या आएगा? Air gets trapped. जो alveolar में air हो जाएगी, that will be trapped. ना अंदर जा सकती है, ना बाहर जा सकती easily. उसकी वजह से क्या हो जाएगा? What will be the effect? The hypoxemia and the hypocapnia. Increased carbon dioxide levels. Acute bronchitis is characterized by a cough that lasts for 3 weeks, and in 90% cases, as I said, it is usually a result of viral. Risk factors include tobacco, smoke, dust, and other air pollutants. And the prevention includes arrest. Prevention is usually symptomatic, and arrest, paracetamol, and non-steroidal anti-inflammatory drugs are given to help with the fever. Folks, what is the elastase? Elastase क्या करता है? Now, what is emphysema? Emphysema is a chronic obstructive pulmonary disease, which is characterized by the abnormal irreversible dilatation of the air spaces distal to the terminal bronchus, and this is also associated with the destruction of their lungs. There is loss of plastic requiring which result in increased lung complex and the lungs.
And third function is that it regulates the movements which are already occurring. Now, I will talk about the direct pathway first, and I want you all to focus on the thalamus side. Inhibiting thalamus, which inhibits the cortex over there. Now, there are two basic neurotransmitters which occur in this process. The first one is glutamine, which is excitation neurotransmitter, and GABA, which is an inhibitor.
रिजर्वेशन होगी तो डोपामिन न्यूरॉन्स की डिजरेक्शन होगी और डोपामिन नहीं निकलेगा। जैसा कि अर्सलान ने पहले ही बोला, डोपामिन का इफेक्ट ऑन डायरेक्ट पाथवे एंड ऑन द इनडायरेक्ट पाथवे। डायरेक्ट पाथवे पे क्या इफेक्ट था? डायरेक्ट पाथवे कराती थी इनिशिएशन ऑफ द मूवमेंट, डोपामिन रिलीज होगा तो क्या होगी? डिफिकल्टी इन इनिशिएटिंग द मूवमेंट। एंड ऑन इनडायरेक्ट पाथवे प्रिवेंट्स द इनवॉलंटरी मूवमेंट्स। अब डोपामिन नहीं निकला तो इनवॉलंटरी मूवमेंट्स होगी बॉडी में, जो कि फीचर है, कैरेक्टरिस्टिक फीचर ऑफ द पार्किंसन।
Now, akinesia is in which the patient is unable to initiate the voluntary movements, or the voluntary movements may be decreased, which is known as the hypokinesia. Now, the basic cause of the akinesia, it is not due to the paralysis of the muscle, not due to the loss of sensory innervation of the muscle, but it is due to the hypertonicity of the muscle, which does not allow the patient to initiate the voluntary movements. Now, there are certain manifestations of this akinesia which we can see in the patient. First of all, this is prolonged walk duration, small step, short steps.
How many is counting money is this?
दिमाग में बताना है कि पार्किंसन डिजीज का कोई परमानेंट क्योर नहीं है। फिर जो हम ट्रीटमेंट क्यों देते हैं? व्हाट आर द गोल्स ऑफ द ट्रीटमेंट? देखो, एक है प्रिवेंशन ऑफ डिजीज प्रोग्रेशन, नंबर सेकंड है सिम्प्टोमेटिक ट्रीटमेंट ऑफ द मोटर सिस्टम, नंबर थर्ड है डिक्रीज विजिबिलिटी एंड राइडिंग, नंबर फोर्थ है एसिडिक मूवमेंट एंड फ्लेक्सिबिलिटी या ऑप्टिमाइज रिएक्ट, फिफ्थ है मैक्सिमाइज ग्रॉस मूवमेंट मोटर कोऑर्डिनेट बैलेंस। नाउ हम तीन तरह के ट्रीटमेंट दे सकते हैं। नंबर 1 we can give non-pharmacological treatment, number 2 we can give pharmacological treatment, number 3 we can give surgical treatment. All the advancement that you have made towards the treatment, they become more and more important because that is how the treatment becomes more and more viable for the disease.
रिलैक्सेशन होता है, वो इलेक्ट्रिकल एक्टिविटी का रिजल्टेंट होता है। हम नॉर्मली ईसीजी का इलेक्ट्रिकल एक्टिविटी का रिजल्टेंट निकालेंगे, उससे देख लेंगे कि नॉर्मल कोई प्रॉब्लम है या नॉर्मल है एकदम।
As we have studied in the sympathetic What are internal glands? Hormones.
So these are the situations.
Third step is the organization of the thyroglobulin. As Ashur Azmi said, the thyroglobulin is a large glycoprotein which contains the tyrosine amino acid residues.
Development, growth, as well as maturation. Inadequate levels of thyroid hormones, especially during the fetal development and early childhood.
This point should be noted here because in the human eye, the greater difference between the refractive indices is between the air and the cornea, where the maximum refraction takes place. Reasons for this, but the most common cause for this is the decreased anterior-posterior diameter of the eyeball or the cornea is altered. If the lens is altered, it is the lenticular astigmatism, and if the cornea is altered, it is the corneal astigmatism.
There are different types of cells which secrete different types of hormones that control the metabolic functions of the body.
It generally results from one of the three abdominal glands. First one is craniopharyngeal. It's a tumorous condition involving the pituitary gland. Second is chromoprotein. Chromoprotein are cells present in the anterior and the intermediate pituitary
Lazy fellow, and it doesn't make any hormone on its own. It utilizes the hormone made by the
Function is it helps when it is released. It helps in the concentration of the urine. It does that by acting on a distal contractile and collecting
calcium binding. So, by the help of cal binding, this is increasing the calcium levels in the intestine.
What happens is it promotes bone resorption due to which there is prolonged case of rickets. In prolonged case of rickets, what happens is there is compensatory increase in parathormone secretion.
The various categories such as abdominal causes, central causes, and the other causes. Causes of the abdomen include gastritis, pancreatitis, jaundice, and the intestinal obstruction.
Yesterday, I was sitting in my clinic, and this is a hypothetical clinic, by the way, and a patient happened to come to me. Okay. Now, as this patient entered my clinic, I realized that this person had this swelling over his face and in the hands and the feet as well. And talking to him, he comes and says, "Doctor, I am having the following complication."
four transporters that facilitate this transport by the mechanism of secondary active transport. And apart from this, when these substances have come inside the cell, this creates the osmotic.
Lead to dilatation of urine, and due to which excessive amount of urine will be excreted, and there will be production of excessive urine, and which will lead to dehydration, of course.
Conversion of heme into bilirubin is catalyzed by two enzymes. The first enzyme is the heme oxygenase, which catalyzes the conversion of heme into the biliverdin and also the iron. And we cannot have free iron in our blood as it is very toxic. So first iron needs to be transported. Iron is transported in the circulation by transferrin
Of urinary transferase. Actually, we know that unconjugated bilirubin present in the blood is taken up by hepatocytes and converted into the conjugated bilirubin with the help of the UDP glucuronide transferase.
It can go up to 25 milligrams per deciliter. और पेशेंट यूजुअली होता है एसिम्प्टोमेटिक लेकिन कुछ माइल्ड सिम्टम्स हो सकते हैं जैसे एक थोड़ा
Second one will be the decreased excretion of bilirubin, and that occurs in the hepatic and the post-hepatic joints.
Actually hemolytic, but present in both hepatic as well as upper. Then Vandenberg test is the test for determining the type of jaundice. It is indirect in hemolytic, biphasic in hepatic, and direct in post.
You did very well. Was your first presentation, but you still managed to do a great job, and it's worthy of praise. So I congratulate all of you for that. It was a difficult decision. So it was a tough competition. So fourth position goes to three groups. Group 1. Please come forward.
Please come forward. Group 1. Group 1.
Group 1.
Group 1.
Group 7.
Group 7.
Group 10 as well.
Group 10.
Group 3. CO3.